Welcome to video F1 of the Medical Entrepreneur IV Chelation training series. I'm Adam Sewell, MD, and in this final video, we're going to go over some of the most frequently asked questions I get from providers just like you, clinicians ready to bring IV chelation therapy into their practice safely and successfully. Let's jump into the answers you need to move forward with confidence. Yes, IV chelation is safe when administered properly. Safety depends on using the correct chelating agent for the right indication, following dosing guidelines based on body weight and renal function, performing appropriate pre-treatment labs, using sterile technique and monitoring protocols. Chelation is a medical treatment. It should be treated with the same respect you'd give to IV antibiotics or chemotherapy. When done right, the risk of adverse effects is low. Borderline lab values, like a blood lead level of 35 to 44 microgram per deciliter, require a clinical judgment call. Here's what to consider. Is the patient symptomatic? Brain fog, fatigue, mood swings, or neurologic symptoms may justify treatment even at lower levels. Is there ongoing exposure? If they still live or work in a toxic environment, chelation may be more urgent. What's their renal function? For borderline cases with normal kidneys, a lower pulse dose of chelator is reasonable. You can also consider oral DMSA as a gentler introduction to detox before escalating to IV. Always individualize, document thoroughly, and if needed, consult a toxicologist. Many uses of chelation, such as for cardiovascular health or general detox, are considered off-label in the US. Here's how to protect yourself. Always obtain informed consent that explicitly mentions the off-label nature of the therapy. Educate the patient using objective, evidence-based language. Avoid exaggerated claims. Stay away from phrases like miracle detox or cure-all. Document why you're recommending it and what alternatives were discussed. Off-label does not mean illegal, it means the provider assumes responsibility for the decision. Document everything. Chelation therapy is typically considered a low-risk outpatient procedure, but it's still critical to notify your malpractice carrier before offering chelation. Ensure chelation is explicitly listed as a covered service in your policy. If you're using compounded medications, confirm your policy doesn't exclude off-label or non-FDA approved meds. Consider an umbrella liability policy if you're practicing under a wellness or concierge model. Most carriers will cover chelation with proper documentation, consent, and training. When in doubt, ask in writing. Let's summarize the key takeaways from this frequently asked questions session. 1. IV chelation is safe when done correctly with monitoring and clinical judgment. 2. Borderline labs, base your decision on symptoms, exposure history, and renal function. 3. Off-label use is legal, but requires clear consent and proper documentation. 4. Always confirm that your malpractice insurance covers chelation. Don't assume. If you still have questions, revisit any of the training modules, reach out to your clinical network, or consult a medical legal advisor. Thank you for being a part of the Medical Entrepreneur IV Chelation training. I'm Adam Sewell, MD, and I wish you all the best as you bring this powerful service to the patients who need it most.